we talk about fusions, because a lot of people say, well, the doctor recommends a fusion. So if you look at, this is a back, from the back. This is the sacrum, and these are the lower back. You would call them the lumbar vertebrae. Now the trouble is, we're not showing the whole spine, but most people will they may fuse L4, 4th, and 5. And the trouble is, what happens above? You're going to get more movement above, and most people coming down to this, look at this model here. This is the sacroiliac. This is the sacrum, ilium. Look at all these deep ligaments here. So what happens is you're going to get a lot of wiggle here. And it wasn't designed our body to get that extra wiggle. So what's going to happen, when we do prolotherapy, the body naturally is going to heal. So all these ligaments will heal naturally. There's not going to be more wiggle. And so these type of people, to be quite frank with you, when they have a fusion, they're very difficult to take care of, because what happens is it's fused and will always be fused. So they're probably going to be a chronic prolotherapy patient, because they'll improve, but it's going to be difficult, because above and below the fusion there's going to be extra motion. So they can be treated. So you would rather not do that fusion. You'd rather have this taken care of by prolotherapy and let the body heal itself. And it can. We're basically giving the body a supercharge. That's all we're really doing, to give it a boost. We happen to know where to put the needles, and the body does the work. It's a very simple procedure.
To add on that note too, we heal, all kinds of soft tissue injuries, but something that patients don't or should understand is that it's not that we make it bionic. If you kind of going to that, it's half you, it's half us. If we are healing, your rotator cuff, but you're still doing push-ups and all kinds of exercises with improper form, that's something that needs to be addressed as well in your visit, because the tissue, we're not making it bionic so that you could do whatever you want, and right. It's not going to...
you can still break down.
Exactly. So that's another part of it too, is that, when we talk about exercise, we always want you to do proper form, because we want, obviously you to be healthy, for you to build healthy tissue, and then have those habits for the rest of your life, so we don't see you 6 months later when you tear your rotator cuff again doing the same exercise.
So what Danielle's saying, we're going to work with a physical therapist or a sports trainer or an athletic trainer, a sports fitness individual. That's very important. Dr. Hauser wrote a great book on Prolo, Your Sports Pain Away, and it's really talking about mechanics. Mm-hmm. So because if they injure themselves with improper mechanics with their throwing, you want to address that. That's really, really important.
Right. Here, back to something you brought out. I think people don't understand that when you have a surgical procedure, almost every surgical procedure that an orthopedist does, I'm not talking about joint replacement, but right. All the other procedures, laminectomy when they take out bone, meniscectomy when they take out the meniscus, like these procedures, what they do is they actually make the joint more unstable, right? Because obviously you need the bone there to provide some stability, and the meniscus or the labrum, that provides anywhere from 15% to 25% of the passive stability of the hip, shoulder, and knee. So a better approach would be anyone who has been told they need a surgery really should go see a prolotherapist. Absolutely. Because even if the surgeon is going to do an operation that's going to get the structure more stable, right? A fusion is the ultimate instability, right? You can't move it. But even that operation, because it changes the normal weight distribution of things, like in other words, they got rid of the instability at L4, L5, but what it created 2 years down the road, 3 years down the road is instability of the SI joint. So if knowing that you would get pain relief for 2 or 3 years, like in other words, we're going to do this fusion operation, and it's going to get you well for 2 or 3 years, but for the next 35 years of your life, you're going to have chronic low back pain that's, in essence can be every bit as severe, you would say, like, I'm not going to sign up for that. So that's why often with our newsletters, and I've been writing about this for 20 years, is when a surgeon says that you should get surgery, run, don't walk to a prolotherapist's office. I mean, at least get an evaluation, because let's be honest, between us, we got nearly 50 years of experience doing prolotherapy. I mean, we know when surgery is needed and when surgery isn't. Right. If somebody's got in their neck or their back something that's crushing the spinal cord, it's crushing the spinal cord. They got myelopathy on the CT scan or the MRI, which I had a case in the last month, and he said, Doc, so who should I go see? I said, so I referred him to a neurosurgeon.
Yeah, absolutely.
So I do refer to a neurosurgeon.
Sure.
That's a spinal cord lesion. Like we can't, you got to get that addressed. You got to get a decompressive surgery, but 95% of the cases or something like that, that when the patient's been told they need a surgery, when they end up seeing us, it's like, John, I'm just telling you, you can get that surgery, but just know these are the long-term effects of that surgery. But I'm telling you, if you let us treat you, 9 out of 10, 9 out of 10, you're going to be satisfied with the results with prolotherapy. So I personally would get prolotherapy.
And people don't realize, they do realize, but the post-operative complications are, I just talked to a gentleman last night who had a total knee joint, and now he's got a deep vein thrombosis, which is a blood clot that went to his lung. Now he's on blood thinners. This is more common than you realize, okay? So wouldn't you rather have a very mild discomfort for maybe 1 to 3 days and get your function back? And most people can go right back to work. You're not sidelined. And if you look at these infections in the hospitals now, that's not going to happen in prolotherapy, okay? It's very, very rare. The side effects, every single person at this table has excellent training, like Dr. Hauser said. There's over 50 years of experience, okay? Things can happen, but they're rarely, very rare. We're continuing to go to school. We continue to upgrade ourselves. Dr. Hauser and Danielle are expert anatomists, okay? So there's very, very, very few side effects, okay? And it's safe. It's a very safe procedure.
And you are encouraged to exercise during the whole thing, unlike surgery.
Absolutely.
Where you're down for the count for X amount of weeks or non-weight bearing. You're encouraged to do exercise. Sometimes, we do have to kind of limit or modify as tissue heals, but we want movement. We want you to swim or to bike or what have you in the process.
And every one of us here has had prolotherapy on multiple parts of our body, and I'm so grateful. I would not be sitting at this table right now, and I'm a very healthy individual because of prolotherapy.